Hello everybody. For this video, I would like to go over bipolar disorder. Bipolar disorder I have mentioned on a couple other videos, and the best way to sum it up is that when an individual is experiencing bipolar disorder, they are constantly feeling alternations between depression and mania. And it's not to be misconceived as a lot of people, I think this one is probably the most common misused term. A lot of people like to refer to themselves as bipolar or love to insult other people and say that they're being bipolar if they have mood fluctuations. And while bipolar disorder does have to do with mood fluctuations, it goes so much more deeper than that. It's not just suddenly having an outburst. It ranges from the fact that these individuals will have long episodes of depression and long episodes of mania. And they won't last a short period of time. They can range anywhere from weeks to months. What happens is that the bipolar brain is severely affected in the hippocampus area, which has a lot to do with some of your emotions and mood, and it has a lot to do also with memory. And it's very interesting because the thing that you typically see is, or it's typically perceived in media, is that all of a sudden this person will be, just crazy and very erratic, and all of a sudden they're just down on the couch. And it's important for more representation to be out there because of the fact that it ranges in the way it's externalized. It ranges in the way that the symptoms manifest in the person and the way the person experiencing it feels about themselves. It's important to see that this person is actually going through something. They're not just being, ever changing. They're not just being switching on and off and switching from this to that. It's so much more to that, and it's important to have a lot of empathy for people that do have bipolar disorder because it takes a toll. And these people already feel stigmatized and already feel ostracized from their symptoms. So it's very important for us to be empathetic, practice a lot of empathy around all disorders, but especially bipolar disorder, since it's taken very lightly and it has a lot of different manifestations. What's typically seen in somebody who has bipolar disorder is that they may be over talkative, and all of a sudden they'll have this burst of conversation. They'll be loud, it'll be flighty, and they'll be hard to interrupt because that happens when they're in a more manic episode. And they may be overactive, elated, and their sleep will very, very much change. So they will go from sleeping a lot to sleeping very little because of the fact that they become so overactive and elated in their manic episode. It's going to cause them to need to do everything and anything they possibly can. And it goes deeper than that because it's not just the fact that they want to be impulsive and do everything on the list and they want to go crazy and they want to be hyperactive and busy, busy, busy. It's actually the fact that the person who's experiencing bipolar disorder is probably very, very, very aware at this point that they do also have those depressive episodes where they're very low motivated, they're low energy, they're lethargic, their mood overall is not feeling well, and their overall perception of life is very, very low and negative. So, whenever these people are going through their manic episodes and they know that their mood is different, they know that their symptoms are very much different, they take advantage of the manic episode. So that's what I want to emphasize. The person with bipolar disorder is constantly in a state of having to overcompensate for the time being that they were in that depressed episode. And therefore, when they go through that manic episode, they're trying to get everything done that they could not even begin to tackle while they're feeling depressed, and vice versa. And when they experience mania, a grandiose optimism and self-esteem overcomes them. So, as opposed to the polar opposite of the fact that they're very depressed, now they're all of a sudden feeling very optimistic and very up for things. So they want to take advantage of that, but the dark side of it is that it can also have a lot of recklessness with it. because of the fact that they're feeling manic and they're feeling a lot of optimism, it can cause them to do reckless things that they think won't affect them or affect others because of the fact that they're feeling that elated state of optimism. They're feeling a little bit more like, okay, if I jump out the window, I can fly in very extreme cases. And that's when it gets dangerous. That's when it gets really bad. That's when it's on the bad side of the spectrum or the less socially acceptable side of the spectrum, so to speak. And when it comes to recklessness, it's a little bit that in the previous video when I was discussing borderline personality disorder and I linked it a little bit to bipolar disorder, it is a little bit hard to distinguish the two because when a bipolar person and recklessness mix, it'll cause them to go on shopping sprees, it'll cause them to do reckless spending because they're feeling very manic and overly optimistic and very up for things and just ready to like tackle it all on. And they'll even engage in hookups. The list goes on and on and on. And it can be debilitating to the person in the long run, and it can have severe consequences because of the fact that the manic episode convinced them that they were invincible with that circumstance and with the outcome of that situation. And that's when it's into that severity, these people do need protection from their own poor judgment because at that moment their judgment is flooded with a grandiosity and illusions. So they do need protection from their own judgments. But I'm going to go back to the other side of it. Bipolar disorder doesn't always look like that either. There are milder forms. And when there are milder forms, some beautiful things can actually manifest in the person with bipolar disorder. And many, many famous people actually contain this disorder. I'll go through it right now. The milder forms can manifest this free-flowing energy. So there's free-flowing thinking and free-flowing energy when they're in their manic episode. So they want to take advantage of that burst of all of a sudden just freeing energy, thinking, and creativity, and it'll fuel all of that. And that's why I mentioned earlier that many famous individuals have bipolar disorder, and many creative individuals have had bipolar disorder, such as, for example, Edgar Allan Poe, Ernest Hemingway, Frida Kahlo was also known to have that, and Carrie Fisher, Princess Leia herself, was bipolar. And look at how much success these people have been able to curate for themselves and what things were able to flow. And more than likely, they were able to flow during manic episodes in their life. And it's very interesting because this disorder also is a little bit more rare than you would think. Well, many people think, and I think it's because of that loosely used term of bipolar disorder, people think it's more common, like, oh, you're bipolar. But actually, it affects 1% of the population. So it's actually not as common as people may think it is on the onset. And their episodes last for weeks or months on end. So it's not going to be just like a day-to-day basis or a minute-to-minute kind of feeling. But the individual will just suddenly feel like, okay, for weeks on end, they feel very creative, very productive, or in the severe cases, very reckless and impulsive. And then all of a sudden, they'll feel really down and just fatigued and tired and sad. And I'm going to go into depth a little bit more of what a manic episode looks like as opposed to a depressive episode. So, for the sense of mania and that mania episode, there will be this overall, like, this sudden increase in the level of happiness and silliness. So, I mean, this person will feel bubbly, they'll feel energetic, they'll feel elated, like they're beyond happy, like nothing can bring them down at that moment. And then on another spectrum, they can also have a short temper and they can be irritable. So it can manifest in that sense too, like if the individual hasn't been able to manage it, or depending on what kind of effect that they have in it, or just their life circumstances, who they are. There's so many different unique facets that can affect the way bipolar disorder, especially manic episodes, manifest. And then all of a sudden, another thing will be that they're all of a sudden, like, comparing it to a depressive episode, they'll be talking really fast, or their thought process will be extremely fast, more than opposed to the baseline. stage that it usually is in. And of course, it'll be like night and day with a depressive episode. There will be this inflated sense of ability, knowledge, and power. So it can range back to that grandiose optimism and self esteem that a person will experience. All of a sudden, there's this just sense of, hey, I can do anything I want. And when the dangerous sense, it can cause someone to do something like a little bit more on the crime side or self harm. But in a positive sense, it can be a little bit more like all of a sudden a person feels less restrained by their judgment. They feel less restrained by that like voice inside of their head that convinces them out of things. And they can create something beautiful without worrying about what people are going to think at that moment. And I mean, it can go either way, really, as long as the person knows how to manage it and knows what the triggers are, what their thought process is, and can be a better self, their best self in facing it when they already are aware of the onset of a manic episode. Reckless things and poor judgment is on the list, and it shows that, I mean, it can really go either way. For a depressive episode and an episode of depression, all of a sudden there will be an increase in sadness and hopelessness. And I want to emphasize hopelessness because depression isn't just someone feeling sad over an event or situation. It's a constant state of being where this individual does feel very hopeless and very stuck. And that happens in the depressive episodes. All of a sudden, this person will just kind of like just wind down, and their emotions are low on the ground at this point. Their esteem is very low at the ground at this point. Um, Also, in a depressive episode, you'll notice that the person is not only feeling lonely, but they can also be isolating and withdrawing themselves a lot from who they were usually surrounding themselves with, either at the baseline or during that manic episode. You'll notice a change in their sociality and who they associate with, and you'll notice it like night and day. Again, like a best way of just comparing manic episodes to a depressive episode is night and day. It's completely polar opposites, hence polar. They'll be their appetite will change too. They'll either be eating too much or too little. Like they will not want to touch a bite of their food. They won't feel enthusiastic about that, or they may be eating too much to try to soothe that sadness inside of them and try to feed whatever hole or emptiness that they're feeling in them during a depressive episode. Because again, depression is so much more than just sadness. It can make a person feel hopeless and feel empty inside. And during this episode, in a bipolar person, they'll be taking on different vices or withdrawing from certain behaviors that are normal and balanced. They'll have little energy and lack of interest. So there won't be that motivation, and all of a sudden, that burst of interest that they had, the burst of energy that they had during a manic episode will be non existent. They'll flatline at that point when they're in a depressive episode. And they'll be sleeping too much. So, whereas a person in a mania will be, getting little sleep because there's so much flowing through them, the person in a depressive episode won't be able to get out of bed. And it's almost as if this person becomes, two different people when they go in and out of that stage, when they go in and out of that cycle. And it can take its toll. It's the again, that term polar opposites is used very commonly, and it's the best way to describe someone with bipolar disorder. It'll be night and day. It'll be all of a sudden this burst of energy, burst of creativity, burst of impulsiveness, to flatlining, fatigue, and extreme tiredness and lack of motivation. And this disorder can be treated in many different ways. This one actually has a couple more branches that it goes off of, and it goes into the medicinal side as well. But if medication isn't right for everybody, it's not a one size fits all, but you do need to talk to a healthcare professional in order to get the right consultation. Again, these are just suggestions that you can address to your psychologist and see if that will be the best treatment option for you if you have bipolar disorder or if a loved one has bipolar disorder. So the options are antipsychotics, and a couple of them can include lithium, I hear. There's mood stabilizers, and mood stabilizers can actually range from antidepressants because of the depressive episodes, or benzodiazepines, which actually is used to also treat anxiety. So maybe that can be a little bit more of a treatment option for the manic episodes. And I don't know if maybe some psychologists coincide them, if it's a good combination or not. But again, that's all things to address with the healthcare professional in order to see if it's the right treatment for you or for your loved one. Another thing that I'll even tie into a historical person that has experience with bipolar disorder, had experience with bipolar disorder. Carrie Fisher underwent electroconvulsive therapy, which is also known as shock therapy, because shock therapy and electroconvulsive therapy is actually very effective in treating people with bipolar disorder. It may be very daunting and very, a harsh, acute treatment option, but it has actually been proven to be highly effective in treating individuals with bipolar disorder. Psychotherapy is also another good thing to pair with whatever treatment option you do undertake, or if you decide to go medicine free, if it's not best for you, psychotherapy is very good for you, and it can be linked with cognitive behavioral therapy so that the individual who has this disorder will be able to understand their triggers, understand the onset of their manic episodes and the onset of the depressive episodes, and be able to observe and record the certain behavioral aspects that follow those episodes of the emotions and thoughts that the mania and the depression can bring on. And being able to assess that and address that and understand that can also help convert the manifestations that bipolar disorder may have. So, for example, if the mania brings on a lot of recklessness, if an individual starts recognizing how they react to all of that, they can also be able to alter it into going into the spectrum of creativity. And for depression, if, for example, this person gets really low and starts isolating themselves, rather, they can, with understanding themselves through therapy, they can be able to assess it in a way where they can be like, okay, isolating doesn't feel good at the moment, even though it is an action that I do. I need to surround myself with loved ones. And the list goes on and on. But bipolar disorder is very much so manageable, and the individual experiencing it is very much so stronger than many people like to stereotype them as. And while it is daunting, and I don't know what stage you are in your journey for improving your mental health state, whether you're barely beginning, whether you've been in it for years, whether you're just trying, that's important. That's important that you're constantly trying. And while bipolar disorder can take its toll, especially because it's such different shifts in your mental state and well-being and the way you are experiencing your own life, it is very important to recognize that there is great strength in somebody who is able to, first of all, the strength comes from being able to recognize what they're going through. And then it comes from wanting to seek help for it and wanting to understand it. Those are the toughest things to ever do, to be honest with you. The tough stuff is being able to face yourself and being able to face the issue at hand and being able to, take the initiative to want to assess it and want to treat it. So I give you kudos if you're clicking on this to try to seek any treatment options and try to better understand yourself, because bipolar disorder is very much real. And bipolar disorder, especially to the person experiencing it, is more than what people stereotype it as. And just know that this is very manageable. Any mental health disorder is manageable, and any mental health disorder isn't always oppressing you. It's important to understand that it's just a part of you, but it is not you. Your mental illness or your mental disorder is a part of you, but it is not who you are. And it's important to keep that in mind carrying on forward, and to just be able to do what we do. The reason why I make these videos is to make sure that whoever watches them, whether they're experiencing it or not, or they're just simply curious, can just expand that compassion and that empathy towards all of the various ranges that psychology can offer, all the various mental illnesses and mental disorders that come with that. And I really appreciate you for clicking on this video and for supporting. And I hope you have a very good mental health day. Thank you.